Thanks very much, I want to join with my colleague, Senator O'Brien, in relation to today's revelations of the last 24 hours on health insurance. I think, in anybody's mind, and following on indeed from what Senator Burke have said in recent weeks about, the discourse on health being quite personal against the minister, it's just simply impossible to ignore the calamity which appears to be our health services at the moment in terms of its funding. On the one hand, we're seeking to introduce under fives free healthcare in terms of the GP for the most wealthy in the country, and on the other hand, we are screwing the coping classes to the wall with continually hitting them and expecting them to divvy up more. The cost for a family with 2 children to pay for a year is going to be an extra €328 or thereabouts. Since 2009, the health levy has risen by 149% for an adult and 155% for a child. We've had the CEOs, as Senator O'Brien has said, from the 3 major hospitals saying they are beyond capacity. They are at breaking point. We've had 150 million cuts to primary care, which arguably has contributed to the 10% rise in those using accident and emergency. And all this against a backdrop where the Minister is saying free GP care for all by 2016 and free and universal health care. Indeed, it's worth noting that some academics are now saying universal health care is not the way to go. And I, for one, if people can afford to pay, I would like them to pay. I don't want multimillionaires to be subsidised by people who have nothing. I don't want multimillionaires to have free GP care for their children. And I think, frankly, and it's no wish to personalise it against the minister, I don't doubt the man's commitment to want to do a better job. But the reality is, even any look, a cursory look, at the health service at the moment would give people the impression that it's a complete headless chicken approach. It's a calamity, calamitous. It's a complete problem, and I think anybody who suggests otherwise is reminiscent of that Iraqi leader saying that they were fully in control winning the war with the tanks outside the studio. There must be a way to come in and discuss what actually is going on. But the question couldn't be clearer, frankly, Cahir. The question couldn't be clearer. Who's running our health service? How much is it going to cost? Where is the money coming from? And why is Middle Ireland constantly being screwed to the wall?
Senator Hart.
Cahir,